The ASHP Research and Education Foundation, in partnership with the Cardinal Health Foundation, is pleased to present the 2012 Award for Excellence in Medication Use Safety. This unique award honors health system pharmacists who exercise leadership that results in interdisciplinary teamwork, innovation, and improvements in medication safety. The 2012 Award for Excellence in Medication Use Safety goes to the VA Boston Healthcare System. As part of the largest healthcare organization in the United States, the VA Boston comprises 3 main campuses and 5 community clinics. It is the largest provider of veterans healthcare in New England. Here is the story of their winning program and the people who benefited.
Be good to get you back at home and everything straightened out.
Hallelujah.
Going home from the hospital, for the patient, it is a return to the familiar. But for healthcare professionals, it is a transition full of challenges.
Any transition of care involving a lot of medications can definitely be dangerous, particularly if you don't understand what you're supposed to do when you get home. And when you're discharged from the hospital, a lot of times that's a confusing period of time.
Concerned by the incidence of medication discrepancies at the time of discharge and the resulting acute care visits and readmissions, pharmacist Allison Paquin assembled a team of experts to analyze the problem and tackle it head-on. They built on an existing clinic-centered program called the Pharmacological Intervention in Late Life, or PIL service, and then designed a home-focused safety net for an especially vulnerable population. Veterans aged 65 or older with some cognitive impairment, taking 15 medications or more, and discharged directly home.
Hello, good morning. My name is Allison. I'm one of the pharmacists at the VA.
The solution centers on direct communications with patients and caregivers after discharge to assess their adjustment to the at-home medication regimen.
Have you had any trouble with that medicine at home?
The types of things we're looking for from a medication standpoint is really what the patient's doing at home and what they may be having trouble with. And with that, there is a certain level of accountability for the pharmacist, because we may be one of 2 people reaching out to that patient after discharge during that critical window where they're still recovering from illness and where things could still go wrong.
Now, as far as your other medicines,
Led by the pharmacist, a team reviews problems that are identified through the phone calls.
When you're dealing with patients with 15 medications, my expertise isn't sufficient to capture all that needs to come out in that patient. We don't know everything, and that's why working with a pharmacist has been so valuable.
The results of the PIL program have amazed even those who designed it. PIL service calls reduce negative outcomes, including readmission, emergency department visits, and deaths by 24%. In 2011, the service saved an estimated $312,000 in costs.
The patients identified in the PIL program have clearly defined vulnerabilities that need to be addressed and show that they need a pharmacist intervention.
And I think the beauty of the PIL clinic is it's something it's a transferable model.
I believe this model is very replicable because it's very low tech. This was staff driven. This is the kind of innovation I and the leadership wants to promote.
Today, the need for the award and the continued investment around patient outcomes and patient safety is needed more than ever. For us, the return on investment is better and safer patient outcomes and better patient care, which benefits all of us.
For its groundbreaking work with the PIL service, the staff of the VA Boston Healthcare System is honored with the 2012 Award for Excellence in Medication Use Safety.